Don't know where we're gonna fly like you did sometimes.
Good morning. How are you today? I'm gonna start as soon as I have someone join me. Who is in the house? Who is in the house? Join me. Let's have a conversation today. I am looking in two places because I have my page open. So trying to connect the two, technology, that is where we find ourselves. So who is in the house with me? Join me. Let's talk. Let's talk. Let's talk this morning. Good morning. Good morning. Thank you. Can you say hello to me? Just send some love so I know who is in the house. Just say hello. Good morning. How are you? Just show us some love this morning. How is your Saturday going? Good. Welcome to another wonderful Saturday. It's going to be a wonderful day. It's going to be a lovely day. This is the day the Lord has made, and we rejoice and be glad in it. As you join us today, be the voice. Remember, this month is the Suicide Awareness Month. So be the voice. Join us to be able to save lives. So welcome. I'm looking at my page because my page is open. Today we're going to focus on something that was started ago. So welcome on a new Saturday. This is the day the Lord has made, and we rejoice and be glad in it. Show me some love. Let me know who you are, where you're calling in from. Show me some love. I know the time could be overwhelming. I know the time could be discouraging. I know the time could be stressful. I know this time could be stressful. But one thing, do not lose hope. Do not lose hope. These too shall pass. Definitely. These two shall pass. It will not remain. I'm looking at it in two places because I have my page open. So today, rise up. Take your place. Be hopeful. Be joyful that you are alive in the land of the living. You are alive in everything that we do. Last time we discussed on what is suicide and the concept of suicide prevention. So if you miss our discussion, I will encourage you to go back and do what? Go back and listen to the video. It will save you. It will save somebody. Share that video with somebody. When you do that, you are amplifying my voice. You are saving lives. I know it's not a common discussion. It's not a common Facebook Live you want to join. But I want to beg you today, stay with me a little bit longer. Let's roll. Before we continue, I want to use this opportunity to thank all our supporters, all of our donors, family, friends who joined us in the 2020 walk-a-thon to create awareness on suicide prevention. I want to say thank you and God bless you. As you continue to join us to build capacity around mental health promotion and suicide prevention, we'll continue to save lives. We continue to do anything we can do to promote overall well-being, because it is our responsibility. It is our goal to do what? To save lives. It could be hard, especially in times like this. This is COVID-19, a new normal. This is where we find ourselves. This is what we're going to live with. How do we prevent suicide even in times like this? How do we cope in times like this. So if you're hearing my voice, invite your friends, invite your colleagues, share this on your platform so that we can save life. This life is sweet. This life is good. But we all have to invest in keeping ourselves alive. So once again, I am your humble sister. I'm your humble friend, mother, social activist, Princess Ruth Ifedora. Mental health promotion and suicide prevention activists. Today we're going to focus on discussing the risk factors of suicide. We have already established that suicide is a global health issue, just like COVID-19 is a global health issue. Suicide is a global health issue. And it affects everyone. Suicide does not discriminate. Whether you're poor or rich, whether you live in America, whether you live in Nigeria, whether you live in Asia, wherever you are, suicide can affect anyone, anybody. But how do we know? Part of the suicide prevention strategy is for us to know how to identify what suicide is and how to take action. So today we're going to focus on the risk factors of suicide. Let me make sure my page is working. To explain the risk factors of suicide, let's just explain two concepts here. Modifiable and non-modifiable situation. We want to explain that before we go further to talk about risk factors of suicide. Anything modifiable is something that you are able to change. It's something that your environment can help you to change. It's something that your own inherent values can help you to change. It's something that resources around you can help you to change. That is what is called modifiable. You can modify it. You can be able to change it. You can mold it. But non-modifiable events, situations, things are things that you don't have control over. There are things you cannot change. There are things that is called non-modifiable. You can't change it. It doesn't matter what you do. You are born and raised with it. You're born with it by the nature, by default. You find yourself in that situation. That is what is called non-modifiable. So how is that relevant to risk factors of suicide? Like we all have established that suicide does not have one cause. However, there are risk factors. Evidence states that risk factors are a combination of relationship, combination of individuals, combination of communities, combination of social, economical, demographic situations that triggers that can arise to risk of suicide. That's what risk factors are. Those are factors that are likely to cause someone to entertain, to think about killing themselves. That is what risk factors are. So these risk factors can be modifiable or non-modifiable. You see the relevance of that non-modifiable. Let me make sure my page is working right. If you're joining us, we're talking about risk factors of suicide. So join us and let's have this conversation. Let me get my page up and running. Oh, hold on. All right. Okay. So yes, my page is up and running. So what I'm trying to say is risk factors of suicide are classified into two. Modifiable, things we can change, things we can modify, things that we have the ability, God has bestowed in us ability to change. We also have non-modifiable risk factors. Non-modifiable risk factors are the things you're not able to change. You can't change it. For example, history of having someone died by suicide. That is not modifiable. I cannot change it. You cannot change it. It's something we have to live for. It's something we have to live with. But the difference is how we react to it. So that is what you mean by modifiable and non-modifiable risk. But either way that it goes, either way that it happens, risk factors are those things that makes it likely that you or someone else or someone that lives in your neighborhood or someone that works with you might be entertaining. They may be thinking about how to take their life because they are in emotional pain, because they are experiencing psychological pain, a pain that you and I cannot see. A pain that you and I may not be able to understand. Only them understand what that pain is. So, suicide, according to American Foundation for Suicide Prevention, said suicide often occur when stressors and health issues, converge together. When they converge together, what happens? It creates a sense of despair, lack of purpose. People around you, they will lose hope. They live with no hope, no purpose in life. They think about no reason to live. That is when most of the time suicide occur. Issues of life, issues at work, issues at home, issues around our school, issues around our family, they converge, they come together. They trigger us to start querying about who we are. They trigger us to start thinking, who are you? You're beginning to question, who are you? What are you? What do you bring to the world? What benefit are you to the world? What benefit are you to your workplace? What benefit are you to your family? Those things that makes you to query yourself. Those things that makes you to question yourself. Those things that makes you to begin to wonder who you are. You begin to think about your identity. Am I really who I think that I am? Who do I represent? Those risks, those factors that makes you to question who you are. Those are the risk factors of suicide. It doesn't matter whether they're a child. It doesn't matter whether you're an adult. It doesn't matter whether you're a teenager. We all are faced with risks in life. And some of those risks we can modify. For example, lack of a job is a risk factor to suicide. Lack of a job is a risk factor. Bad relationship, negative relationship, domestic violence from emotional abuse, from psychological abuse, from physical abuse, from financial abuse, lack of finance. Lack of finance is a risk factor to suicide. When a man wakes up in the morning and he cannot provide for his family, and he cannot talk, he's just there looking at himself and seeing himself as a failure. All he could see around himself is failure. All he could see around himself is failure. No productivity. Not relevant in the economy. Not relevant in the community. Not relevant in the house. What else comes to their mind? They begin to question who they are. They have that pain that only them can feel. And the next thing they will think about is start entertaining. You know what? I am of no good to this world. I am of no good to this community. I am of no good to my family. I need to kill myself. That's what happens. Lack of job. We talked about that. Lack of money. That is why I became an independent, licensed, independent financial professional. So that I can have the ability to have an overall abilities, resources to contribute to overall well-being of individuals. If there's anything so stressful that can trigger stress in this life, is lack of money. It's not that people don't make money. People do make money. But how they manage the money they make for the money to work for them is what they don't know. So as a billionaire, I will teach you, if that is your risk factor, that you're making money, but you're not seeing the money you're making. Every day you go to work, you come back, you work so hard, but you cannot see what you're working for. You put your money somewhere, the market crashes. Call me, talk to me. Let's evaluate your portfolio and see what we can do to reduce that stress. That is our job. Lack of money, poverty. Evidence have linked poverty to suicide. Because when someone cannot eat, they cannot feed, they cannot have a roof over their head, what do you think going into their mind? What do you think going into this brain? Other people will be boasting about how they have a bad day for their children, how they took care of their wife, how they took care of their husband, but you have nothing to show for it. Meanwhile, you go to work every day. Or probably you don't even work. Or you'll be working and they just lay you off. Because of the COVID-19. You see, when we talk about prevention during the COVID-19, suicide prevention, because of the COVID-19, a lot of people have been laid out of work. That is the risk factors to suicide. You are thinking that I'm going to get risk factors from... No, the risk factors live with us. It lives around us every day. It lives with us. A lot of people have thought that, oh, when we talk about suicide, we're talking about mental health disorders. No. Suicide is not, and I will say it in all my presentation, suicide is not a mental health disorder. Mental health disorders are one of the risk factors of suicide. Mental health disorders such as depression and any other mental health disorder could be a risk factor to suicide. Because evidence says that 90 to 95% of persons who died by suicide either have untreated or undiagnosed mental health issues. That is fine. Mental anguish, emotional anguish is a big risk of suicide. Emotional anguish. Bullying is a risk factor of suicide. Our children are being bullied when they go to school, especially children that have special needs, kids. Some of them, their colleagues, their peers, we do what? We start talking about how they look. We start talking about how they walk. We start talking about how they laugh. Simple things, things as simple as that is a big risk factor. Bullying. We as adults, we bully others. We bully people through social media. We bully people through gossiping. We bully people through different media. Bullying is a risk factor to suicide. So if you engage or if you involve yourself or if you see someone bullying others, please intervene. Intervene so you can save lives. Intervene so you can save our community. Stop bullying. Be the one to stop bullying. Be the one to stop bullying in the school, in the community, at work. Leaders of job, leaders in organizations, stop bullying your employees. Employees, stop bullying your managers. It creates emotional anguish. It creates mental tension, which can result in suicide. Another risk factor of suicide is what? Medical conditions. Imagine you've been living your life, you have planned your life the way you want it. All of a sudden, they give you went to the doctor and they said, oh, Mr. Jones, you have 6 months to live. Wow. How does that sound? I know what will be going into your mind. 6 months to live. So all I have done in life is a waste. I only have 6 months to live. Or you get that diagnosis that says you have kidney failure. Chronic conditions are not treatable. Something like kidney failure, they are progressive disease condition. They are not treatable, but you can reduce the progression. Medical conditions, certain medical condition, cancer, kidney failure, heart failure, name it. They are all risk factors to suicide. So you a nurse, you the doctor, you the healthcare professional, when you're releasing those diagnoses to your patient, do you refer them to a psychologist to help them process that information? Before you give that diagnosis, do you have a psychologist readily available? It's not to give someone diagnosis today and say you have cancer, you have kidney failure, you have heart failure. You give them and you make an appointment for them to see a psychologist in 1 month. No. Within that 1 month, something can happen. You, the doctor, you, the provider, you, the pastor, you, someone who is releasing that information, who is giving that bad news. Have you thought about the impact of that bad news to that person's life? Have you thought about the impact of telling Mr. Jones, who have worked all his life, and you wake up and tell him, oh, according to the result, according to the diagnosis, you have 6 months to live. Really? That is okay. You still have to say it. But what we're asking you, do you already have a psychologist? Do you have a counselor, a therapist to work with these people to process this bad news? Or do you just release it? Oh, I'm a doctor. A woman came to hospital to deliver and the baby died. There's no counselor, no therapist to help them process the loss. Another risk factor is a loss of a loved one, loss of a child, loss of a family member, loss of a job, loss of anything, loss of a limb, loss of an eye, loss of anything can trigger suicide behavior. How are you disclosing the news of any kind of loss? You healthcare provider, Miss Angel, thank you for joining us. Invite other people to join us. Show me some love today. You healthcare provider, friends and neighbors, how are you releasing negative results? How are you releasing negative news? Do you just wake up and call your sister and said, do you know our daddy died today? Not knowing where your sister is. You don't care whether your sister is on the roadside. You don't care whether your sister is driving. You don't care whether your brother is driving. You just call, daddy just died. Mommy just died. Sylvester, thank you for joining us. We're talking about risk factors of suicide. And what we're discussing now is loss. Loss of anything, loss of a loved one, loss of a child. A mother has been pregnant for 9 months, only to go to the hospital, expecting to carry their baby, expecting to breastfeed their baby. All they could hear is, your baby is dead. That is fine. We have to deal with the bad news. But what is your preparation as a healthcare staff, as a pastor, as a nurse, as a doctor, as anything? What is your preparation to provide a therapist, to provide a psychologist, to provide a family member to be around before you release that news so that they can help that person process that information? It takes a strong heart. It takes a strong mind to withstand loss, to withstand bad news. It can change someone's life for the rest of their life. Loss of a job. Somebody has been a CEO all the rest of his life. All of a sudden, he came to work and they give him that letter. You know, organizations don't know how they contribute to people dying by suicide. Communities don't know how they contribute to people dying by suicide. Leaders don't know how they contribute to people dying by suicide. That is why people, once they hear suicide, they think it's all about mental disorder. No, everything around us that is not functioning in order contributes as a risk factor to suicide. Anything around us, name it. Relationship, divorce. Divorce is a risk factor to suicide. Break a relationship that is not husband, just boyfriend and girlfriend. You see someone who attempt to kill themselves. Miss Akudo, thank you for joining us. Relationship, bad relationship, negative relationship contribute to risk factors of suicide. Share with us, Mr. Sylvester, Angel, Mr. Akudo, tell us, just use the chat box. What do you think are the risk factors of suicide? That's what we're discussing today. What do you think contribute? What experience? Have you encountered anyone, if at all? As a person as I am at risk because I lost a loved one by suicide. So, losing a loved one by suicide is a risk factor. Substance abuse, mental health disorders, medical health disorder. These are all what? These are all risk factors to suicide. When you have feeling of hopelessness, impulsivity, being aggressive for nothing. Angel, yes, Angel says stress, isolation, life circumstances. Yes, Angel, let's talk about this isolation. How does COVID-19 contribute to isolation? I love this. Isolation is a risk factor. I agree with you. You can see the implication of COVID-19 to high rise of suicide in our community. Because with COVID-19, we are practicing physical distancing. Thank God for digital platform that allow us to see ourselves. That is why I try not to use that word social distancing, because we're not socially distancing anything. If we do, the suicide would be more on the rise. We are practicing physical distancing. It prevents us from coming together. Coming together, we all are social beings, and we depend on one another to thrive. We depend on one another to obtain our fulfillment. But when we distance ourselves, that particular gap, that creates a gap right there. Yes, Angel said cause, loss of a child, death or place in care. If you're watching me, if you don't know what that, if you lose a child, for example, when someone is incarcerated, when someone is arrested and put in the jail and they have a child, you know what they do? The child is taken away and placed in a custody. The mother, the parents are not there to take care of that child. That is a loss for that parent. Or the parent is alive due to certain situation that we don't know, their child is taken away and placed in a custody somewhere else. That is a risk factor right there. Negative thoughts, family members. How are we supporting one another? When last did you call your brother? When last did you tell your family there is hope? When last did you tell your sister there is hope? When last did you tell your children there is hope? Those are risk factors. Negative environment, toxic environment. They are all risk factors to suicide. You can see that is encompassing what the risk factors are. It's so much. So let's not just focus that it's just mental disorders. No, mental disorder is just one element. It's just one risk factor to suicide. There are a bunch of them. Cultural and religious beliefs. Cultural and religious beliefs. What are those things? Some people believe that suicide is a noble solution. That is a belief system. So how are you going to manage that? Some people said it's an evil spirit. People call it different things. But I want to tell you today that suicide is not an evil spirit. If you want to convince me with that, bring it up. Suicide is not an evil spirit. But suicide is not an acceptable approach to dealing with stressors of life. There are ways out. There are ways out. Suicide is one of the most preventable deaths on earth. But you and I are responsible to engage in the prevention. And one of the prevention strategies is education. And that is why Comfort Foundation have taken it upon themselves to educate you and I. For us to engage in this conversation. For us to normalize conversations around this area. It's not an evil spirit. Let's talk about it. When we go to church, we pray. Prayer, spiritual belief is another way to draw closer to God. It's another way to have purpose in life. But it's not enough for us to pray. It's not enough for us to pray. We need to be able to love one another. We need to be able to incline to one another. We need to be able to connect to one another so that our prayer could be effective. Yes, Miss Akudo said, everything that triggers you into trying to take your own life, various loss, stress, isolation, job loss, anger. Anger. Can you imagine that? Relationship, career, shortcomings, several issues that affect us mentally, family issues, job challenges, toxic friendship, environment, mental problems, cultural belief, academic, they are enormous. So when you wake up tomorrow and you're talking about suicide and suicide prevention, know what is the cause. There's no one cause. There are so many risk factors. And it's not enough for us to know. It's not enough for us to know. It's for us to take action. The first step, which all of us are doing today, is to know. Help us, Jocelyn, thank you for joining us. Help us to amplify our voice. Help us to normalize this conversation. Help us to create an environment that allows people to vent, that allows people to talk about who they are, that allows people to discuss what concerns them, what matters to them. Create that environment. Be available to people to talk about. Be the one to. There's the acronym there. Be the one to. Be the one to ask. Be the one to keep that person safe, including yourself. Personalize it. Bring it home. Starting with yourself. How are you feeling today? Do you feel like you need to talk to someone? How do you evaluate yourself? Any reflection going on within you? Who are you? Are you questioning who you are? Are you questioning your identity? Is your job not functioning well? Miss Angel, I'm working on that. But before the book, just share this video so that someone else will hear. Are you questioning yourself? Are you thinking about who you are? No, there is hope. There is life. There is hope. Don't lose it. Okay? When you feel like you are being cut off, you're being cut off in the environment. Nobody cares about you. Oh, nobody loves me. Oh, nobody loves me. I'm all alone. I want to tell you today, you're not alone. You're not alone. If you feel lonely, you're alone. Call Comfort Foundation. If you need to talk to someone, call Comfort Foundation. 469-850-3337. Call or send a text. I will call Our members will call you and will just listen. If that is all you needed, you're not alone. Don't feel that isolated. You're not alone. Feeling isolated is a risk factor. I've talked about physical illness. Easy access. Another risk factor is easy access to little meals. Easy access to gun. Easy access to drugs. Easy access to chemicals. Easy access to anything that can help people, or they can make it easy for people to die by suicide. Is another risk factor. So when you're buying that gun, hey, Agatha, how are you? When you're buying that gun, when you're buying those chemicals in the house, when you're buying those alcohol in the house, how are you protecting your family members? How are you saving your family members? Because when someone is in that mental tension and feel that they have no place to go, the pain is so much, nobody is listening to them. Nobody is believing them. Nobody cares about them. And they have access to gun. They have access to alcohol. They have access to little means. They may end up dying by suicide. And you begin to live in regret. For every suicide, evidence shows that about 25 to 30 suicide attempts. World Health Organization said every 40 seconds. Hi, Miss Lillian. Thank you for joining us. Please amplify our voice by sharing this video. Let's save a life today. This month is Suicide Prevention Awareness Month. Be part of it by just at least share this video for someone to learn. I'm talking about access to little means in the house. Take away those guns. You don't need them. I'm here to see that so many people have saved their life with gun. Take it away. Take away those guns away. Is what? Is dangerous. Unwillingness to seek for help. Unwillingness to seek for help because of what? Because of stigma. Because of what people will say. Because of religious practices. Because of cultural practices. You people don't want to talk about who they are. And if you're from Africa, where I came from, or you want to say, oh, keep your problem with yourself. You don't want anybody to know. Please don't talk to anybody. Please don't let those people know, so you don't want them to laugh at you. Let me tell you the truth. Whether you talk about your issues or not, people will talk about you. And even if they don't talk about you while you're alive, they will talk about you while you're dead. It might as well allow them to talk about you while you're alive, while you seek for help. Risk factor of suicide is unwillingness to seek for help, associated with stigma, social stigma, associated with religious practices. I don't want them to say I'm an unbeliever. Who told you that you're an unbeliever? That's why you're thinking about killing yourself. That is life from the pit of hell. Who told you that? Who said that? You don't want people to know that you're hearing voices. You don't want people to know that you lost your job. You just get into the house and lock yourself up. No. Unwillingness to seek for help is a risk factor to suicide. We want you to seek for help. If you see me, Princess Ruth Ifediora. If you see me not behaving right, please reach out to me. Be the one to ask me, am I okay? Be the one to make sure I'm safe. Send me to resources where I can obtain resources. Be the one to ask me, are you doing okay? Olubukola, thank you for joining us. Unwillingness to stigma. People have stigmatized issues around suicide and mental disorders. Please, you need to be alive, let alone to consider about stigma. Be alive first. Reach out. Seek for help. Reach out. Ask people. There is nothing anyone is going through in this life today that no one have not gone through. There is none. There is none. There is no situation that is bigger that will consume you. There is no situation that is bigger that will, he said, instead of consuming you, it makes you better. But you have to seek for help. You have to reach out and find out people who has gone through it. How did you manage this situation? Oh, you were a nurse at Hickory Village. You're a nurse at White House and you are fired. How did you manage that situation? When you lost your child, how did you manage that situation? Reach out and ask for help. Someone has gone through that situation. Don't worry about the stigma. Don't worry about cultural belief. Don't worry about religious belief. It has never. No negative cultural belief. No negative religious belief has ever helped anyone in this life. That is why even the Bible said that my people perish due to lack of knowledge. The Bible acknowledged that unwillingness to seek for help, unwillingness to seek for knowledge does what? It is a disservice to yourself. You're doing yourself, you're doing your community, you're doing your family a disservice for not seeking for help. It's a risk factor. It's a risk factor. Another risk factor is what? We talked about unemployment, poverty. We talked about that. Let's just talk about non-modifiable risk factors. All we talked about are modifiables. You can modify loss of job. You can modify not being able to ask for help. You can ask for help. You can educate yourself. But what are those non-modifiables? Something like family history of suicide. Losing someone from suicide. You can't change that. That is me right here. But since I cannot change it, what do? I channel it to a positive way of saving lives through education. That is what I did. Family history. They said if you or your loved one has died by, if someone has died by suicide, their loved ones are at risk for suicide. Family history of child maltreatment. History. Anything that has to do with history is a risk factor of suicide. Family history of child maltreatment. Child abuse. Domestic abuse on the side of the child. Children are being taken as slaves. Children are being taken as housemaids in Africa. I believe it's happening here too in the Western world. Children are being taken as housemaids. Children are being maltreated. Children are being beaten. That's history. It causes trauma, it causes pain. And that child will grow up with that pain in their heart. And sometimes they don't even have nobody to talk to. And they grow with it. And they live with it. It becomes a trauma they live with. And it only takes God's grace for someone to come to their rescue. History of child maltreatment is a risk factor to suicide. It's a big time risk factor. Previous suicide attempt. A lot of people who have attempted suicide in the past and they did not die by suicide are they are likely to die by suicide. So if you're hearing my voice, you have entertained, you have talked about, you have in any way, I want to let you know there is hope. Do not let go. There is hope. I know that pain is so strong. The pain is there. That emotional anguish is there. Reach out. Do not do it. Stop. Do not kill yourself by suicide. History of mental disorders. Why this is huge is because when you have a mental disorder, you may not cognitively think right. And when you're not cognitively thinking right, you have a brain disorder, the tendency that your thought process might be negative is high. So, history of mental disorders is a non-modifiable risk factors. You know why? Because our communities are contributing factor to stigmatize people who are diagnosed with mental disorders. This is just a diagnosis. Mental disorder is just a diagnosis. It's not the person. These people were a person. They were human beings because they diagnosed them with before they diagnosed them with mental disorders. Please normalize discussion. Mental disorders is a brain disease. It's brain, this brain that you and I have. It's not evil spirit. It's not mommy water or papi water, depending on where you're coming from. It's not the cause of your neighbor. It's a brain disease. Because it's a brain disease, it's also what? Treatable. Early identification leads to early what? Treatment. People can have mental disorder and still function in their full potentials. So do not stop that stigma around mental disorders. That is why people that are diagnosed with mental disorders tend to kill themselves. Because people are stigmatizing them. People are bullying them. People are not allowing them to function. It's kind of, they're written them off. No. These people were sick. They were sick. They are fine right now. They are on medication just like anyone that has blood pressure is on medication every day. I take my high blood pressure medication every day. That is the same thing with somebody that have mental disorder. Why would you like to stigmatize them? It's just like somebody who have cancer, who take medications every day to deal with the pain. It's just like somebody who have headache, who need to take medication to deal with that headache. Why will you want to stigmatize someone who has a brain disorder? Mental disorders are brain disorders. And they are treatable. So let's help ourselves by normalizing conversations around mental disorders so we can promote our mental health. That is another non-modifiable risk is loss of a loved one. I lost my mother by suicide. That is why I'm doing what I'm doing. That you watching me, that you see me here, do not go through that pain. It's painful. If you don't know, I want to let you know it's painful. I can't change it. It's a risk factor. A woman who lost the son, the daughter, the children, is painful. How can you tell that person sorry? Tell me how you want to. If you're watching me, please, Angel, Lillian, Agatha, tell me how you want to tell someone who lost their child, who expecting their child, their son, their daughter to take care of them in the old age. How do you want to tell them sorry? That is pain that you live with every day. But the difference is how you respond, how you grieve. There's no more grieving process. How you grieve is what makes the difference. So, loss of a loved one is non-modifiable risk factor of suicide. What about the kids? What about the kids? Let me tell you, kids don't kill themselves because of what happens to them, according to Dr. Lulu. No, kids don't kill themselves because of, hi, Ola, how are you? Ola, Beke. Kids don't kill themselves because of what happens to them. No, they kill themselves because of what happens in the environment. They kill themselves because the mother is there but is not available. The father is there but is not available. They come to ask you questions, you call them, shut up! Who would ask you to talk about that? And when you do that, know what? They retreat. Once they experience that, they retreat. And they begin to blame themselves for even asking the questions. And when they retreat, so many things continue to bob in their head. Oh, what have I done wrong? Oh, I've disappointed mommy. I've disappointed daddy. I've disappointed uncle. So they kill themselves because of what happens in the environment. That is kids. Another reason why it's likely for the kids, for kids, suicide is the second leading cause of death, ages 10 to 34. The second, even more than the road traffic accident. Ages 10 through 34. Another reason why kids kill themselves, according to evidence, is they have not built their resilience, their resilient pocket, their resilience agenda, their resiliency is what? Has not been built yet. So ability to stand the adversity is not there. Ability to stand, ability to stand, to understand how to manage situation. They have not built that yet. What is happening? They don't have the ability to withstand. You know, resilience is as the ability for you to withstand adversity, for you to fall back and come back, like Robert. When the issues of life, when events of life pushes you back and forth, you're able to bounce back. Ability to bounce back, that is resiliency. That's what resilience is. But children yet, they're still immature. Their thought process is still immature. So what is that? They're irrational. So they don't have ability to bounce back. So if anything triggers them, they want to let it go. That is why we, the parents, we have to be our children's best friend. Even if you're struggling, do not let go of your children for someone else to care for. They will never care for that child the way you, the mother, will. They will not. Take care of your kids. Listen to them. Do not force them. Thank you, Olo. Olo says suicide is real. Yes. I keep pushing because of my daughter. After losing my son, January, lost my father, July. Oh my goodness. Oh Lord, this is so painful. Lots of issues beyond my control. I feel like giving up, but I won't. Please, oh Lord, thank you for venting this out. This is the beginning of your recovery. Ability for you to air this on social media is the beginning of recovery. Hang in there. You're not alone. If you want someone to talk to, call my number. Call Comfort Foundation number 469-850-3337. You're not alone. It's painful. Medication does not care for it. Medication does not care it. Is what is painful. But thank you for ability for you to vent. You are on your journey. This is beginning of your recovery. This is beginning of your recovery right there. But make sure you reach out to a therapist also. Oh Lord, I encourage you today, reach out to a therapist. Oh my goodness. Yes, your basket is loaded. But sister, you can still hang in there. You will make it. But I want you to reach out to a psychiatrist, a therapist, a counselor that will help you also. Because this is full. Yes, I'm happy that you're strong. I'm excited that you're strong. I am excited that you're strong. But remember, in the days of dark hours, it may come. When it surfaces, do not let go. Reach out to someone. Reach out to a therapist. Reach out to a counselor. Reach out to someone. Yes, let's talk offline after this. Okay? Let me see. Inbox me in my personal. Let me connect you to someone. Yes, that is what Comfort Foundation does, is to educate and to refer. That is what we do. We don't actually treat, but we educate you on what you need to know, and we refer. We try to support you. We try to provide you with resources. But the number one resources we want to give you is this education. Know that you're not alone. Know that what you're going through right now, someone else has gone through it. And you can make it. You can make it. Yes, you can. It's hard. It's painful. It's pain. There's so much losses out there. But I bet you, if you can hang in for another second, thank God you're strong. And I believe that someone else will learn from your story. I believe that someone else will benefit from your story today. You know what you have done today, Olo? You have really saved someone's life. By being able to vent, by being able to speak up, that is your first journey to recovery. Recovery is possible. Recovery is real. Recovery is real. But in the journey of recovery, distractions are going to come. There's going to be distractions along the way. But ability for you to not allow those distractions to distract you is what helps you to continue on the journey of recovery. Thank you, sister. Thank you for venting out today. Thank you so much. So, as we're saying, we talked about the children. My sister have just finished this. She have laid down to you all the risk factors of suicide. Teenagers, we talked about children. Of course, the same thing that happens to adults happens to children. The same thing. Bullying, peer pressure, and all that. Teenagers, the same thing. Teenagers feel rejected. They want to feel belong. How are you managing your teenager in your neighborhood? How are you managing your teenager in your house? They will come to you. The one we're struggling with now, hey, princess, how are you? In my house now is, oh, there's people all over my body. Mommy, I need cream. I need cream to fix this. I still have to listen. I still have to listen. Because, yes, I can see the changes. But do I want her to behave the same way I behave? No. Teenagers need your love. Teenagers need your listening ears. Please don't shout at them. Don't ignore them. Every complaint they come with is legit. Don't scare them away. Listen to them. For all of us here that are parents, do not send your kids and say you must have 100 in school. We have to encourage them. If they will have 100, that is fine. But it's not. You wake up in the morning and say, it is either 100 or no way. We need to learn, especially if you're an African watching me, we need to learn how to celebrate any little success. If your child go to school and score 10 over 100, it's not what you're expecting, but what is your reaction? You need to welcome them in and celebrate the 10. Learn how to celebrate 10. So you can learn how to celebrate 20, 30, 40, 50, 60, 70. When you do that, they will come to you. When they're struggling with anything, they will come to you because they know that their parents, their uncle, their sister will celebrate them regardless of where they find themselves. Learn to celebrate. I use my daughter as an example. My daughter is a teenager. She's 14. She will come. She wants to have it the best. I say, sister, what did you have today? Oh, I have 80. I want to get 90. Let's celebrate the 80. Wow, you did a good job. When we celebrate the 80, let's talk about what happened to the 20 later. Learn to celebrate. Learn to be with them. Education does not give you money. I want to tell you to everyone hearing me now. Education does not give you money, but education opens the doors for you to think right. Education helps you to find solutions to your problem. Education helps you to find the right people, to network with the right people. Self-education is what gives you money, not certificate education. I encourage everyone to get educated, but don't put it in front of your kids and say, go to school and make money. That theory has never win. That theory, it has never win. It's a good theory. I'm not asking, I am in my PhD journey right now. So I'm not asking anyone not to go to school. But don't stress your kids and keep telling them every morning, go to school so you can make money. No. Go to school so you can live a better life. Go to school so you can understand your environment. Go to school so you can learn how to network with people. Go to school so you can learn how to educate others, not how to make money. What gives money is self-education. Certificate education helps you earn a living, but self-education helps you earn a fortune. And the number one foundation of self-education is what? Emotional intelligence. Emotional intelligence. So the teenagers feeling rejected is a risk factor. Peer pressure, bullying, loss of their classmates, their friends, their neighbors, they can all contribute. They are all risk factors of what? Of suicide. I think we have done justice to this today. So if you're just joining us, what we talked about are risk factors of suicide. And we said that risk factors are a combination of social, relationship, community, economic factors that can trigger suicide behaviors. And we said they can be divided into modifiable and non-modifiable. Most non-modifiable deal with histories. You can't change history, but you can change how you respond to it. But modifiables are the things you can change. Loss of a job. Can you empower yourself to become employed? Can you? Yes, you can. Can I help you to get a job? Yes, I can help you. We can work on your resume. We can work on your CV. We can apply for a job. If you lose your job and go and lie, that job will not come to you. Okay? Divorce is history. Those are not modifiable. Feeling rejected, stigma. Those are some of there are huge risk factors. Bullying, peer pressure, toxic environment, negative people, negative environment. Those are all mental health disorders, medical disorders, name it. Loss of a job. Those are all risk factors of suicide. Now we know what suicide is. We know what suicide prevention is. Today we talked about risk factors. Next week, Saturday, we're going to talk about protective factors. Please come back next week. Thank you, Miss Olo. Thank you, Miss Olo. Share this video so that someone else will benefit from it. Next week, same time, 11 a.m. Bring someone. I know this is not a common topic that people want to watch on social media, but we have to educate our people. We have to normalize this conversation. I will see you again next week, Saturday, 11 a.m. by God's grace. Invite your friends. Let's have a discussion. Let's share among ourselves. Let's be the one to save ourselves and save our community. Be the one to ask, are you okay? Do you have thought of killing yourself? Be the one to protect them. Be the one to provide the resources. Be the one to do what? Follow up. Yes, I am. I am on YouTube. Angel, can you inbox me so that I'll give you my detail? But you can also reach out to us at www.thecomfortfoundation.org. I will put it on the page here. www.thecomfortfoundation.org. Or you can also reach out to us at our email, comfortfoundation@outlook.com, or call our phone number 469-850-3337. So see you on next week. Thank you all for joining me. We'll meet again next week, Saturday, same time by God's grace. Until we meet again, do not kill yourself. Be your brother's keeper. Be your community keeper. Be your family keeper. Be the one to bring that soothness. Be the one to bring that therapy. And if you or your loved one is in crisis, if you're in the United States, call 1-800-273-8255 or text HOPE to 741-741 or call 911 or go to the emergency room or talk to your doctor. If you're not in the United States, please go to any of the emergency rooms. Talk to a doctor, talk to a therapist, talk to a psychiatrist, talk to someone. But please do not kill yourself. You're not alone. This period shall pass. I love you all. Continue to hang in there. Continue to empower yourself. Continue to equip yourself. If you're in the United States, you need help, especially if you're in Texas, if you're in Maryland, if you're in New York, if you're in Illinois, California, and you need help looking at your financial portfolio, inbox me. Let's talk about that. Lack of money, poverty is a risk factor to suicide. Until then, I love you all. Thank you for being with me today. Share, and share. That is the only way you can amplify our voice. See you all next week, Saturday. Thank you.
Of mine, what do you feel beside? I don't know where we're gonna fly like you did sometimes. Seeing